An example of someone who might be eligible under that law may be someone who is, let's say, in their 60s. They've suffered from a severe mental illness such as depression throughout their lives, maybe since their 20s for many decades. They have had access to and undergone extensive interventions of different varieties. So there may be treatments that are biological, like let's imagine someone who's had 15 or 20 antidepressant trials, including maybe mood stabilizers or antipsychotics, which we also sometimes use. They've also had maybe neurostimulation, and that would be treatments like electroconvulsive therapy, ECT, or transcranial magnetic stimulation. They would also have had psychotherapy. The standard evidence-based psychotherapy for depression would be cognitive behavioral therapy. We also sometimes use something called interpersonal therapy. They may have undergone individual and group therapy. The person may have also been in hospital before because of exacerbations of their illness and has had hospital or residential treatment. So it's someone who has had an extensive history of treatment, but without a response in their illness or without sufficient response that their quality of life is acceptable to them. They're still suffering unbearably. That person would have to meet all the criteria already required, including capacity with respect to decisions and all of the safeguards Jocelyn outlined in the beginning. And that person would be making the request voluntarily, which is part of those requirements. In a perfect world, they would have had access to all of the reasonable interventions. And if they hadn't, they would have been helped to get access to that by the MAID assessor advocating or working with their treatment team to ensure that that's been done. And this person has hopefully also had access to appropriate income supports and housing. And again, that would be offered if it had not yet been as part of the MAID assessment. So this might be the picture of someone you see, and I have assessed patients like this, many of whom actually have had the means outside of public healthcare. They've actually had the means to achieve numerous treatments and high quality care. And so for those individuals, they've reached a point where they can't bear to continue going on as is.